It's like the chair and the vice chair got a haircut.
Springtime. Good to go then?
Darren, can you confirm?
Okay.
Yeah, we're good.
Yep, we're live. Okay. Thank you, everyone, and welcome to the meeting of the Ottawa Board of Health. We're dealing with Agenda 23. Just a few reminders before we get started. Anyone participating is on mute unless called upon to speak. Those participating by phone, please keep phone on mute at all times unless called upon to speak, and do not put the phone on hold. And please avoid using speakerphone when speaking. Please speak directly into your device's microphone or your telephone receiver. Good evening, everyone. Bonsoir, Kwe. Thank you all for being here today. I'd like to begin this meeting by honoring the Algonquin Anishinaabe Nation, land and people. Ottawa is located on the unceded territory of the Algonquin Anishinaabe Nation and is a gathering place for many Indigenous peoples. On behalf of the Board of Health, I would like to honor the land and the peoples of the Algonquin Anishinaabe Nation, whose ancestors have lived on this territory for millennia, and whose culture and presence have nurtured and continues to nurture Inuit and Métis peoples, their elders, their ancestors, and their valuable past and present contributions to this land. Now I'd like to ask the Board Secretary to conduct the roll call, please.
Thank you, Chair. Member Banham?
Present.
Member Cloutier?
Present.
Member El Shantiri? Member Gower?
Here.
Member Kavanagh?
Here.
Member Lakin? Member Menard?
Present.
Member Pinel? Member Tilley?
Present.
Vice Chair Di Giovanni?
Present.
And Chair Eglai.
Here.
You have quorum, Mr. Chair.
Thank you. So we'll go through the procedures for the meeting, though I'm sure we all know these by heart by now. But so the following procedural guidelines are implemented to promote an orderly proceedings of this virtual meeting. Should members need to leave the meeting, they should advise verbally that they're doing so by clicking on Leave Meeting from the Zoom platform or ending their call if participating by phone. In terms of speaking order and the process for speakers, I will provide each member with the opportunity to ask questions or comment. Members will be called on to speak in the order or reverse order as set out in the Board Secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on a given matter, you may decline verbally when your name is called. For voting purposes, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried, and then call for dissents to ensure that all order, privilege, or challenge procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Should technical difficulties or other unforeseen matters require a recess during the course of the meeting, unless the Board Secretary issues new instructions, members are requested to remain on the line. The Board Secretary will mute all participants in such an instance. Are there any declarations of interest? Okay. Seeing none, we'll move on to confirm the minutes of the meeting of February the 28th, 2022. Can we confirm them, please?
Confirmed.
Thank you. 6 communication items have been received. Can we receive these communications as noted in the agenda?
Received.
Thank you. I'm going to ask Member Banham, please, to move the motion to introduce reports.
Thank you, Chair. Oh, that's helpful. Okay, be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled Board of Health Policies and Bylaws 2022 Review and Updates, participation in the Association of Local Public Health Agencies, Alpha 2022 Annual General Meeting and Conference, Emergency Management at Ottawa Public Health Annual Update, Ottawa Public Health Strategic Plan for 2019-2022, update from Q4 of 2021 operating and capital budgets, year-end results, Board of Health for the City of Ottawa, Health Unit Status Report and Delegation of Authority, contracts awarded for the period of July 1st to December 31st, 2021, be received and considered.
Carried.
Carried.
Thank you. We'll now go through the usual consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda, and for any items where board members don't have any questions or concerns, and we don't have public delegations registered to speak, the board may carry or receive those items on consent, which is to say without any discussion. First is my verbal report, so we'll hold that. Second is Dr. Etch's verbal report. We'll hold that. We also have one delegation in that regard. Next item is the Board of Health Policies and Bylaws 2022 review and updates. Carried?
Carried.
Thank you. Following that is participation in the Association of Local Public Health Agencies Alpha 2022 Annual General Meeting and Conference. Carried?
Carried.
Thank you. Emergency Management at Ottawa Public Health Annual Update. Received?
Can we just hold that for a quick question?
Absolutely. Is it really quick, Member Menard? Perhaps we could do that now.
It is quick. It's just about the relationship with the heat warnings and flooding related to climate change and OPH's role there, I guess. And our real need to push in the future on the health effects of climate change. And so in the report, it goes through some of these aspects on emergency management preparation. And I would be very interested in OPH staff views of, the municipality's role and health role in tackling climate change, given many of these emergencies are climate change related.
I'm just wondering, that sounds like it might be a little bit more of a longer answer.
Fair.
Well, I also could point to the information previously distributed on our agenda. We have a report on a part of our work related to climate change, which is to take the projections for temperature and weather and climate change, and to think about the health impacts and the vulnerability of people with respect to health. And in fact, so that is just at the stage of consultation. So you will be getting a full report on that. And it's informing the city process. So the city also is undergoing this look at not only mitigation, which we have roles there too, to help people generate fewer greenhouse gases, but also adaptation. How can we look at building that resiliency? So it's certainly, this is one of our priorities. It's actually one of the areas we didn't stop working on through the pandemic, and we're looking to invest in more in terms of staff resources as we can return to other public health work. So happy to discuss it more, but it's one of our top priorities in our healthy communities goals.
Does that work, Member Menard? Otherwise, I think we'll put it on the regular agenda to discuss further down, because we do have a delegate waiting to speak.
No, I think that's good, Chair. Thank you so much. I would just reiterate our need to get involved when it comes to transportation and our buildings in particular. Those are the top two emitters in Ottawa, and our health outcomes are very affected by our modal share and by the way we design and retrofit our buildings. And so I'm looking forward. I saw that IPD. Really appreciate that. I'm looking forward to public health's involvement, intervention in council discussions around climate change and its effect on emergency preparedness and a whole bunch of other health related issues. So thank you, Chair, for the opportunity.
Okay, so can we receive the report then? Or
Received.
yes? Okay, thank you.
Received.
Ottawa Public Health Strategic Plan for 2019-2022 update from Q4 2022. Received?
Received.
Thank you. 2021 operating capital budget year-end results, Board of Health for the City of Ottawa Health Unit status report received.
Received.
Delegation of authority contract 2021 received. Okay, thank you. Circulated to board members in advance of the agenda. One, updates on the impacts of COVID-19 on congregate living settings in Ottawa. Two, update on Ottawa public health, climate change, health vulnerability assessment for extreme heat to improve community resilience, which is what Dr. Etches just referred to. And thirdly, reducing the harms from gambling in Ottawa, progress report to the Board of Health. Does anyone wish to lift any of the IPDs for consideration? So we'll now go to my verbal report, which is the first item, health. And to begin the verbal update tonight, I'm very happy to share that on Monday, April 11th, in a virtual ceremony hosted by the Assemblée Parlementaire de la Francophonie, Ontario branch, and in the presence of the Honorable Elizabeth Dowdeswell, Lieutenant Governor of Ontario, Dr. Etches was one of the 6 Ontarians to receive Order de la Pléiade. In Luxembourg in May 1967, the Assemblée Parlementaire de Francophonie, or APF, brings together delegates of 90 sections from parliaments across the 5 continents. It is a consultative assembly of the Francophonie. The Ontario Legislative Assembly sat as an observer from 1981 to 86, when the Ontario section became a full member. The APF's actions aim to contribute to the influence of the French language, as well as the development and reciprocal knowledge of cultures and civilizations. The Pléiade, Order of the Merit of the Parliamentary Assembly de la Francophonie, is intended to recognize the remarkable contribution of personalities who have distinguished themselves by serving the ideals of the APF. Dr. Etches was nominated for this award by local MPP Lucie Colliard, and she was selected as one of his 2022 recipients by a cross-party selection committee of members of Ontario's Legislative Assembly. It is an honor that she proudly accepted on behalf of the entire OPH team. It is also worth noting that another distinguished Ottawan was also on with the one, Chief Executive Officer of Mouvement d'Implication Francophone d'Orléans, an organization that highlights Francophone culture and promotes the cultural expression of the Orleans community and its surroundings. Congratulations to all the recipients. As we know, public health is the invisible guardian of our health. Though the COVID-19 pandemic has made public health more visible and its efforts more appreciated. Earlier this month, from April the 4th to the 8th, Canada's Public Health Associations hosted the inaugural Canadian Public Health Week, which provided an opportunity to recognize the contributions of public health and highlight issues that are important to improving our health and well-being. This inaugural Canadian Public Health Week featured a series of free webinars focusing on topics such as public health responsibilities relative to climate change, the impact of COVID-19 on public health, and income as a social determinant of health, and learning from the basic income and decent work movements. I understand that public health units across Canada were invited to participate. Hope that many were able to do so given the workloads that they continue to shoulder. Since April 5th, OPH has been creating neighborhood wellness hubs in 5 locations across the city as a pilot project. To better support the wellness of Ottawa residents, staff working in the neighborhood wellness hubs are promoting mental health and substance use health directly in our communities and connecting residents with social services supports. The 5 locations are Rideau Rockcliffe, a community resource center at 815 St. Laurent Boulevard, Bellevue Community Center at 1475 Caldwell Avenue, Albion Hetherington Recreation Center, 1560 Hetherington Road, Boys and Girls Club Ron Colbus Clubhouse, 2825 Avenue, and Boys and Girls Club Don McGann Clubhouse at 430 MacArthur Avenue. To reduce the stigma and barriers to accessing mental health and substance use supports, the Hub service provides access to culturally diverse public health staff. Residents are able to access strategies, tips, and resources on wellness, support with booking of short-term counseling, system navigation of mental health and substance use health counseling and programs, and access to social services through the Community and Social Services Department's Employee and Social Services teams. OPH is proud to be operating these pilot neighborhood wellness hubs in partnership with the City of Ottawa's Community and Social Services Department, Upstream Ottawa, Access MHA, Counseling Connect, one call, one click. Information about the services available, their hours of operation can be found at ottawapublichealth.ca/neighborhood wellness hubs. In closing, I would like to once again encourage everyone to get vaccinated for every COVID-19 dose they are eligible for. Everyone aged 12 and up is eligible for a third dose if it has been at least 168 days. That's approximately 6 months since their second dose. And as of April 7th, the Ontario government has expanded eligibility for fourth doses to anyone aged 60 and over, as well as First Nation, Inuit, and Métis individuals and their non-Indigenous household members aged 18 and over. Per provincial guidelines, the recommended interval for fourth doses is at least 140 days or 5 months after receiving the third dose. However, individuals who wish to receive their fourth dose at a shorter interval may be able to access it between 84 days or 3 months and 140 days, 5 months. In this situation, OPH recommends that clients consult their own healthcare provider to assess personal risk of benefits of receiving vaccination earlier. Based on the 5-month interval, can book an appointment either through the provincial COVID-19 vaccination portal or the provincial booking line. Those wishing to get their fourth dose based on the shorter interval must book an appointment through the provincial booking line. The provincial COVID-19 vaccine portal, that is the online booking system, will not book appointments on the shorter interval. Booster doses can also be assessed through participating pharmacies or by dropping into one of OPH's COVID-19 vaccine clinics. Not only do booster doses lower the risk of severe illness, they also reduce the COVID-19 therefore not only or potential pressures on our healthcare system, it also reduces the amount of COVID-19 circulating in our community, which is particularly important in the context of a resurgence that we're currently undergoing. That concludes my verbal report. I'd be happy to take any questions. Seeing no questions, can we receive this report? Thank you. I'm now going to ask Dr. Etches to provide her report, after which I'm going to ask Councillor Menard to introduce after Dr. Etches provides her report. And then before questions to staff, we'll hear from a delegation. So Dr. Etches, I turn it over to you.
All right, good afternoon. Kwe, Unukut, Tanishchi, Annie, and bonjour. So before I get into my verbal report, I do want to recognize that May 5th is coming up, and it's the National Day of Awareness for Missing and Murdered Indigenous Women and Girls. It's also known as Red Dress Day, and this is arising out of the fact that Indigenous peoples account for 4% of the national population, yet Indigenous women and girls are 12 times more likely to be murdered in Canada compared to their non-Indigenous counterparts. And approximately half of the cases go unsolved. So the Native Women's Association of Canada estimates that there are over 4,000 missing and murdered Indigenous women and girls in Canada. So held annually on February 5th, the Red Dress Day was founded by Métis visual artist Jamie Black to shed light on this crisis. By wearing red on Red Dress Day, we can demonstrate allyship and solidarity with Indigenous communities and raise awareness of this tragedy and injustice. And the Board of Health Reconciliation Action Plan includes acting on the missing and murdered Indigenous women and girls reports, the report's calls to justice. and there will be an update provided to the board on this action plan in September. I'm going to first speak about our budget. The 2021 year's budget supported more work than ever to address the COVID-19 pandemic and to restore some public health programs and services. So the total expenses incurred in 2021 was $157.8 million. And this included $89 million of expenses that were related to the 2021 COVID general response and vaccine program. And it included costs incurred by our city partners for the delivery of the vaccine program. And I'd like to thank the province and the Ministry of Health for their ongoing support. On March 31st, 2021, that would be actually this year, 2022, they confirmed that provincial funding will fully cover all COVID-19 related extraordinary expenditures, and that allowed Ottawa Public Health to balance its 2021 budget. Je tiens à remercier la province et le ministère de la Santé pour leur soutien continu. Le 31 mars 2022, ils ont confirmé que le financement provincial couvrira entièrement toutes les dépenses extraordinaires liées à COVID-19, ce qui a permis à Santé publique Ottawa d'équilibrer son budget 2021. And so with this funding, Ottawa Public Health was able to respond to the pandemic in the community, lead the vaccination campaign with the city that resulted in vaccination coverage rates higher than in any other large city in Ontario, and to maintain and then begin to restore essential public health services, to improve our community's access to mental health and substance use support, parenting programs, emergency dental treatments for low-income residents, sexual health and harm reduction services, and to prevent other infections. So still turning to COVID as an important subject, the goals of the pandemic response continue to be to limit morbidity and mortality and to limit social disruption. And the level of population immunity now is enabling people to have access to more determinants of health, such as more employment, physical activity options, and social connections, without causing the level of severe COVID illness that we reached at previous heights. Le niveau d'immunité de la population permet aux gens d'avoir accès à davantage de déterminants de la santé, tels que l'emploi, les possibilités d'activité physique et les liens sociaux, sans que le niveau de maladies graves liées à COVID-19 atteigne les sommets du passé. On April 7th, I joined other Eastern Ontario medical officers of health and the Champlain region's hospitals' chiefs of staff to issue a joint special statement noting that the wastewater signal in Ottawa and around the region was at record levels. And in that statement, we recommended the following 4 things that people can do to protect themselves, their families, and our communities, with the goal of reducing severe illness and hospitalization. So to get vaccinated with all the doses they're eligible for, to limit their close contacts as much as possible, which really drives transmission, to wear a mask in indoor public spaces, to stay home when sick, even if the COVID test is negative. On Friday, April 22nd, so just recently, the province did announce that masking requirements that were set to expire on the 27th of April will continue until June 11th. So this includes the requirement to wear masks on public transit, in all healthcare settings, in long-term care and retirement homes, as well as in shelters and other congregate care settings. And we're working with our partners in these sectors to support employers to have policies in place after this, before this time, to be able to continue or to reinstate protective measures when the COVID-19 level in the community is high. And with respect to higher risk environments, such as congregate living settings, Ottawa Public Health is also strongly recommending that they continue to comply with infection prevention and control measures as part of their occupational health and safety policies. These measures would include continued encouragement of active screening, vaccination, and masking. We know even in these high-risk settings, not all employees yet have their 3rd dose, and it can make a difference. Given the current high levels of COVID-19 in the community, we continue to strongly recommend wearing masks in any indoor setting where physical distancing may be difficult or impossible. And I'm also supportive of measures that can be taken to increase mask use during this resurgence, including policies in specific businesses, workplaces, and community settings. We've created new products for businesses to use, such as signage that indicate masks continue to be strongly recommended while no longer required. And we're looking ahead to future resurgences of the virus. We know that we have an ongoing role to help people and employers understand what the risk is from COVID-19 in our community, what they can do to decrease risk, and how we're also taking action to decrease that risk. Nous envisageons les futures résurgences du virus et savons que nous avons un rôle continu à jouer pour aider les individus et les employeurs à comprendre quel est le risque lié à COVID-19 dans notre communauté, ce qu'ils peuvent faire pour réduire le risque, et comment nous prenons aussi des mesures pour réduire le risque. So we're continuing to release weekly animated presentations of key data and messages for the public to provide this guidance. We've also created a website that provides more information about who's at greater risk for severe outcomes of COVID-19 and how to use the different layers of protection to decrease risk. This helps people understand their personal risk, the risk to their families, as well as how to adjust their behaviors. And we encourage everyone, as the chair did, to still pursue vaccination. And I just want to recognize this is National Immunization Awareness Week as well. It celebrates the difference that immunizations have made for the health of our population over time. So we're promoting the third dose for anyone over 12 who hasn't received theirs yet, and fourth doses for people who are eligible. And we also see people are still coming forward for first and second doses as recommended. It's never too late. Nous continuons à encourager la vaccination. Les troisième doses pour les personnes de plus de 12 ans qui n'ont pas encore reçu la leur et les quatrième doses pour ceux qui sont éligibles. Nous constatons aussi que les gens continuent à se présenter pour recevoir la première et la deuxième dose, comme recommandé. Il n'est jamais trop tard. So we know that getting vaccinated reduces the risk of severe illness or death from COVID-19, and it helps to reduce the risk of spreading the virus to others, especially with 3 or more doses. We also know that immunity wanes over time. And so for those who were vaccinated months ago, it is important to get that third or even fourth dose to help boost their immunity. We're also continuing to share information to raise awareness about the eligibility criteria and availability of antiviral treatment for those who get COVID-19 and are at risk for severe illness, such as older adults and people who are immunocompromised. A key concern for us at Ottawa Public Health is to ensure that communities that have historically faced higher rates of severe COVID-19 illness are reached with this information, and that people who may be eligible for treatment can access testing and treatment even if they do not have a family physician. Certainly the availability now, as the program continues to evolve, the antiviral program, the availability of Paxlovid in 211 pharmacies across Ottawa is making the treatment more accessible. We're continuing to work with partners like the Southeast Ottawa Community Health Centre to reach high priority neighborhoods with various supports. And it's the Ottawa Public Health Community Engagement Team. It's been present in all high priority neighborhoods to promote community, school, and neighborhood clinics. People from this team have been attending community functions, food distribution programs, and places of worship. There's been targeted outreach to reach older adults in high priority neighborhoods. And the community engagement team's working closely with the mobile vaccine team to prioritize groups who have additional mobility or transportation barriers, such as older adults living in aging in place buildings and families and newcomers living in shelters. Working alongside community partners, these outreach efforts have also helped dispatch more rapid antigen test kits right into neighborhoods. And we're now working collaboratively to increase access to the antiviral treatment information. Excuse me. there's another product that you might have heard of, a protection for people most at risk for severe COVID, the Evusheld product, which delivers COVID-19 antibodies to people who are significantly immunosuppressed through 2 intramuscular injections. It's becoming available in Ontario shortly. And the specialist physicians who are able to identify the patients eligible for this approach are already generating their lists to be able to notify people who are eligible. So Ottawa Public Health continues to update our dashboard daily from Monday to Friday. And with respect to the current COVID-19 situation in Ottawa, I'll just paint the picture with the latest data we have. The wastewater signal continues to point to very high levels of COVID in the community. Though there has been a slight downturn in the 7-day average, it looks to have begun on April 11th. The percent of people testing positive is relatively stable. And as the number of new hospitalizations, people showing up and requiring hospitalization for active treatment of COVID, it's been stable over the last couple of weeks. The total in hospital is up this week from last week. And we understand that staff absenteeism at some Ottawa hospitals is also stabilizing. There does continue to be a challenge in recruiting nurses and others with specialized healthcare experience. And Ontario Health is working with local hospitals to assist with managing the situation. It's been worsening over the 2 years of the pandemic, and it's expected to remain a challenge into the future. The number of new outbreaks as a last measure that we track is also relatively stable week over week. And it's encouraging to see there is protection from 4th doses, leading to fewer people testing positive and less hospitalization amongst residents in long-term care and retirement homes that are experiencing an outbreak. So as the provincial guidance for response to the COVID-19 pandemic continues to evolve, and we see the protection against severe illness that's been achieved with vaccination and exposure to the virus, we're continuing to return to more public health work that doesn't directly involve COVID-19. So looking ahead to the remainder of the year, I'd like to highlight some key initiatives that will be the focus of our work for the next 8 months. Of course, Ottawa is still very much responding to many of the community needs from this current COVID-19 pandemic, this resurgence. And at this point, the key areas of our pandemic response include communications to the public to ensure they receive accurate and timely information, delivery of immunizations, infection prevention and control supports in congregate settings, long-term care homes, retirement homes, and ongoing surveillance efforts, such as assessing vaccine coverage across Ottawa and in high priority neighborhoods. So I expect much of this work will need to continue at various levels for the remainder of the year. But despite this, some of our COVID-19 related work will continue to gradually decrease into the next several months. This includes some of our case management work to align with provincial direction, reducing some of our immunization clinics to match community demand, and reduction in our infection and prevention control work as outbreaks subside. So we're doing these demobilizations while maintaining some capacity to respond to future surges. These reductions will help us align to the budgetary plan that was submitted for 2022. You may recall there were some key targets of decreasing our COVID-19 work. We expected we'd be able to do 75% level of response by May, 50% by June, down to 30% by the fall. And of course, these are estimates, and we will continue to be mindful of the changing situation and maintain capacity to respond to future variants. The province and the science table are monitoring the level of immunity after vaccination over time, and this information will guide any recommendations for additional COVID-19 vaccinations in the fall. Ottawa Public Health is planning to maintain some capacity for COVID-19 immunization in the fall, such as additional booster doses for people at greatest risk for severe illness. And gradually reducing some of our COVID-19 work also allows the organization to focus on our other important priorities and strategic work for the remainder of the year. La réduction progressive d'une partie de notre travail sur COVID-19 permet aussi à l'organisation de se concentrer sur d'autres priorités importantes et sur le travail stratégique pour le reste de l'année. So I'm pleased to say that many of our core services continue to ramp up, including harm reduction, which is at a 90% service level, healthy growth and development, supporting new families at 90%. Our mental health and substance use team is currently at 75%. Our dental health services are at 75%. Most recently, our chronic disease and injury prevention team is starting up at 25%. And some of our non-COVID immunization work has also been able to advance. Of course, other work has been maintained, such as the policy work that addresses the built environment and climate change, and the follow-up of non-COVID infectious diseases, and the focus on our mental health strategy and the Ottawa Community Action Plan for substance use. For the remainder of the year, we're aiming to restore other key parts of our core work, including moving beyond risk-based approaches to safe food and water and personal service settings inspections, and our supports for schools heading into next year's school year. So in 2022, Ottawa Public Health will also be driving forward with our strategic work and action plans on our 6 strategic goals. One of the key areas of our strategy includes our approach to diversity and inclusion. And Ottawa Public Health has focused efforts on diversity inclusion training for our employees and our leaders, which is ongoing, and an independent diversity and inclusion audit of our approaches is informing future actions. And I look forward to sharing these results and recommendations that come from this audit back to the board. We're in the process as well of adding a new position of Program Manager, Health Equity, Diversity and Inclusion. It's a position that will report directly to me and bring more lived experience to the Ottawa Public Health senior leadership team's decision-making. At our last Board of Health meeting, I shared the Ottawa Public Health Recovery Roadmap, and I can confirm that it is still being used to align our strategic initiatives, the COVID response, and restoring some of our core public health services. We're still in step 2 of our recovery plan because it's important. It includes the engaging and hearing from key stakeholders, our partners, community members, and employees on how we can learn from COVID-19 and apply these lessons into our work, and also about how Ottawa Public Health can best meet the public health needs of Ottawa residents. So for community partners and community engagement, we're being deliberate in ensuring that we're working with other City of Ottawa departments, such as the Community and Social Services Department, to co-design and co-create a community engagement and recovery plan with the community, so that the actions and recommendations that we learn through this engagement process will inform future plans for both OPH and the city. We know that the city services also affect the determinants of health and influence health. So this work with partners in the community is going to continue for the remainder of this year, and it will therefore also likely influence our future strategic plan. A key component of our recovery work is ensuring that we also focus on employee recovery. Our employees have done amazing work over the last 2 years, which I'm so thankful for. And I know they are tired from this prolonged process. Un élément clé de notre travail de rétablissement est de veiller à ce que nous nous concentrons aussi sur le rétablissement des employés. Nos employés ont fait un travail extraordinaire au cours des 2 années. Et pour cela, je suis reconnaissant. Mais je sais qu'ils sont fatigués par cette réponse prolongée. So we're continuing to emphasize the importance of taking a rest, taking vacation and time off when possible. And we've identified a full-time organizational development consultant to ensure that we advance our Wellness at Work action plan, which includes helping supervisors and managers best support their teams with flexibility, effective two-way communications, and encouraging and promoting social connection. We're also promoting trauma-informed leadership training in how to handle difficult situations, mental health group debriefs, and peer supports for employees that need additional assistance. Ottawa Public Health will be part of the City of Ottawa's Employee Engagement Pulse Check in May, and this is always an important way to hear from employees about how they're feeling in the workplace and what additional supports are required. We are also hearing very clearly from employees about their concerns for their own employment and job security, especially as some of our COVID-19 related work demobilizes. As a reminder, before COVID-19, Ottawa Public Health had approximately 700 employees, not all full-time, and we hired approximately 3,500 additional employees. Again, not all full-time, many casuals that helped us when they could, and it did include 600 full-time people at the peak of the response to ensure that we had the capacity to meet needs in the community for immunization, following up with people who tested positive in their contacts, to help manage the outbreaks, support the school community, and reach the community in new ways through our community engagement team. So we have committed to employees that there will be regular communication about their roles and any changes. And future positions will be posted for competitions to fill the positions in compliance with collective agreements and to ensure a transparent process. There will not be enough positions to retain all temporary employees, and many employees that were hired temporarily to support our COVID-19 work will see their assignment end by the end of the year. So I want to thank again all the temporary employees for their valuable contribution in supporting our response to the pandemic. We could not have protected and supported the population without their work. And we're making sure that we let people know where there are ongoing opportunities to work with Ottawa Public Health or across the city. It could be other opportunities. So lastly, a key project underway is an independent review of how Ottawa Public Health has responded to the COVID-19 pandemic and what we may need to reflect on for the future. This work will provide another perspective from an external reviewer on how we can learn from COVID-19 and apply learnings into our future work. The goal is for this work to be complete before the summer ends, and so I anticipate bringing the findings and recommendations to the board. Before I take questions, I would like to recognize Dr. Sarah Funnell, who earlier this month left her position as Associate Medical Officer of Health with Ottawa Public Health to work full-time at the University of Ottawa's Centre for Indigenous Health Research and Education, where she's pursuing her passion and working to establish collaborative approaches for research and education with Indigenous communities and organizations. Plus tôt ce mois-ci, le Dr. Sarah Funnell a quitté son poste de médecin hygiéniste associé à Santé publique Ottawa pour travailler à temps plein au Centre de recherche et d'éducation en santé des Autochtones de l'Université d'Ottawa, où elle poursuit sa passion et travaille à l'établissement d'approches collaboratives pour la recherche et l'éducation avec les communautés et les organisations autochtones. So during her time with Ottawa Public Health, Dr. Sarah Funnell was a tremendous asset to the organization. She played a major role in our reconciliation work in partnership with First Nations, Inuit, and Métis peoples and communities to advance Indigenous health equity. And she took on the role of manager of Ottawa Public Health's COVID-19 case and contact management team at a critical time in the pandemic when the need for case and contact management massively increased, and Ottawa Public Health rapidly expanded its work in this area. So I know she'll be greatly missed by the team here at Ottawa Public Health, and that we will have opportunities to continue to work with Dr. Funnell in her new role. So I hope you'll all join me in wishing her well and thanking her for her contributions to our organization and the health of Ottawa's population. A recruitment process has started to find another Associate Medical Officer of Health. And so I'd be happy to take any questions. Cela conclut mon rapport verbal. Il me fera plaisir de répondre à vos questions.
Thank you, Dr. Etches. I echo your sentiments about both Dr. Funnell and also about all the part-time temporary employees that came and answered the call to push back against COVID in our community. We couldn't have done the job without them. It also was lovely to hear updates about non-COVID related programs and initiatives and how we're getting back on track after months and months and months of COVID update, COVID update, COVID update. It was really quite lovely that we're getting in order. We're getting back to basics of public health should be providing to our community. We're revving our programs up. So thank you so much for that news. I'm going to ask, Councillor Menard has a motion arising out of the report. I'm going to ask him to introduce that. So it's on the table before we have our public delegation. Then we'll go to our public delegation, and then we'll come back to you, Dr. Etches, and staff for questions. So Member Menard, if you would like to introduce your motion.
Okay, thank you very much, Chair. Whereas Ottawa continues to see high rates of COVID-19 based on available monitoring indicators and can anticipate future resurgences of COVID-19 as the virus remains present in the environment and population immunity may wane. And whereas masking and vaccination lowers the risk of severe outcomes and reduces the risk of transmitting COVID-19 to others, thereby reducing the amount of COVID-19 circulating in the community. And whereas the province of Ontario prematurely removed mask mandates in essential service settings, schools, and indoor spaces where people work closely together, thereby increasing risk of transmission prior to a sixth wave of the virus. And whereas the province reversed parts of the Reopening Ontario Act, largely preventing local public health officials from issuing letters of instruction, which can mandate masking requirements in local jurisdictions. And whereas Ottawa Public Health and community partners continue to do intensive outreach work in high priority neighborhoods to increase vaccine confidence and grow vaccination coverage, and dedicated funding is only available for some neighborhoods in Ottawa with lower vaccine coverage rates, and other needs for intensive outreach now include promoting testing and treatment for people at higher risk for severe outcomes who do not have access to a primary care provider. And whereas going forward, it will continue to be important for local public health units to have a variety of tools and resources available to enable them to respond to any future resurgences or future variants. Therefore, be it resolved that the Board of Health for the City of Ottawa request that the province of Ontario, A, continue to actively promote vaccination and amplify messaging about how the public and employers can adjust their use of the layers of protection to prevent COVID-19 transmission as levels of COVID-19 fluctuate in the province. B, re-enable local medical officers of health to issue letters of instruction, including for masking in essential service settings, schools, and indoor spaces where people work closely together as part of the local toolkit to reduce the impact of COVID-19. And C, extend and expand eligibility for high priority communities, funding to additional neighborhoods with lower vaccine coverage rates and greater barriers to health to support tailored interventions to increase uptake of vaccination, testing, treatment, and access to wraparound supports and personal protective equipment. So Chair, I'll wait for the delegation and then can speak to it more after that if you'd like.
I think that's appropriate. Thank you. I'll do with that particular motion. We have one delegate tonight, Tanya Naylor. Tanya, are you with us?
Yes. Hello.
Good evening. You have 5 minutes, and I turn them.
Great. Thank you, Chair, for the opportunity to speak today. My name is Tanya Naylor, and I'm here today to speak as the parent of 2 children under 5 years old. Parenting young children during the pandemic has been a stressful and often isolating experience, but it's also left me deeply disappointed in how little children's well-being seems to factor into decision-making. They say it takes a village to raise a child, but right now it feels as though the village has abandoned the kids. My children have missed out on many experiences I had hoped they would have in their early childhood, as we did our part to keep our community safe. Now, while children like mine remain ineligible for vaccine protection, the public health measures we relied on to reduce community transmission have been removed. Masking is not recommended for children under 2, and no antiviral treatments have been approved for children. It feels like we have been forgotten and forced to gamble with our children's health to participate in society. The 5th wave brought on by Omicron saw hospitalization rates in children increase beyond what was seen in previous waves. And now during the 6th wave, children's hospitals like CHEO are again sounding the alarm about high patient volumes, as well as challenges providing care due to staff absences. Hospitalizations, however, should not be the only concern. The Ontario Science Table recently acknowledged that post-COVID condition will likely impact society for years to come, and its impact on children is unclear. In light of that, decision makers should apply the precautionary principle and take steps to reduce the risk of infection. That is why I'd like to urge the medical officer of health to take action to reduce the risk of infection. The medical officer of health has supported mask requirements being reinstated at Ottawa Carleton District School Board, as well as post-secondary institutions like Carleton. However, masking has not been reinstated in childcare settings, and it has not been reinstated in essential service settings like grocery stores and pharmacies. So I would like to urge the medical officer of health to do whatever is within her power to urge mask mandates to be reinstated in those settings, as well as to open up eligibility for PCR testing for children under 5. And I know some of this may be within the province's jurisdiction, but I believe Ottawa Public Health can advocate for those steps to be taken to better protect our children. Thank you very much.
Thank you, Ms. Naylor. Are there any questions for the delegation? I'm going to have a couple of questions for Dr. Etches and staff arising out of your presentation, Ms. Naylor, but are there any questions directly for the delegation? Okay, seeing none. Thank you very much. And again, I don't know if others, but I will certainly have some questions for Dr. Etches arising out of the presentation that you made.
Thank you.
So we're going to go to questions, and I'm going to start off first with a more general question. Then Dr. Etches has indicated I'm going to have a question related to the delegation that we just heard. I'm wondering if you could talk a little bit more about the process someone needs to go through to obtain antiviral. I've heard that there's still some, it's not necessarily a smooth process. I'm hearing from some constituents. I'm wondering if you could talk a little bit more about how someone could get assessed and get access to antivirals, and who or what level of government is responsible for setting up that process and tweaking it if tweaking is necessary.
Certainly, yes. So you're asking about antivirals. Right now, the treatment that's available, Paxlovid, it is a system under improvement, I would say. So ongoing improvement is needed. We've seen some improvement. It started, it's under Ontario Health that this program was begun with limited supply, right? There wasn't a lot of antiviral supply to begin with. It started to be provided out of limited number of sites that were typically more tertiary care. In Ottawa, that was the Ottawa Hospital, had a clinic. What's clear now with a greater supply is that the points of access are increasing. And so now primary care physicians are able to prescribe the antiviral. And there are 211 pharmacies that can actually then take that prescription and dispense the medication to people. Now, what's a challenge, maybe still we're hearing, is that people have trouble getting a family doctor's appointment to get the prescription quickly, because there's a 5-day period where you need to get the antiviral within 5 days of the onset of symptoms. You need to have proof of a test. So that may be one challenge to overcome. If people don't have a family doctor or they can't get an appointment quickly, then the assessment centers are really where people should turn, because the assessment centers have the capacity to do the test. The turnaround time is very good, and then they're able to link people to the treatment. This is if they're eligible, right? So there's a process to determine if people are eligible. Just because you're over 60 or immunocompromised, there's some other things that need to be checked, whether people have drug interactions or other contraindications to the antiviral. And the Ottawa Hospital Clinic is also serving people who don't have a family doctor. So again, that's a place where people can go. And I think the system is still working out how much capacity is needed at some of these central sites, like the Ottawa Hospital Clinic, versus in the primary care system. Does that answer your question?
It does. Just a very quick follow-up before I move to questions related to the presentation. There's so much COVID information on our website, and people have come to trust that and go there. So yeah. The process you've just outlined, how to get access to antivirals, is that information on our website?
Yes, it is. People can look for COVID-19 testing and treatment, and that will point people in the right direction to the healthcare partners that are providing that.
For that, just a couple of quick questions, Dr. Etches, related to the delegation we just heard, who raised two primary concerns that I noted. One is access to PCR testing for 5 and under, and also access to vaccinations for 5 and under. I'm wondering if you could speak to those two issues, what the challenges are in regard to them, and when we might see changes coming down the road.
Sure. The first one about PCR testing, I'm not expecting any significant changes in the provincial approach because the idea of the PCR testing is to use the capacity for people who are at risk of severe illness. So it would be available for children who need assessment for severe illness, such as, in the Children's Hospital of Eastern Ontario, people presenting with more significant symptoms. And then it is available also for those children that may be in families where the healthcare provider is serving a high-risk setting. So long-term care homes, hospital staff, workers, the children may be eligible in those situations as well, where it's important to know if it's COVID so we can maintain the health system functioning and keep COVID out of situations where people are more vulnerable. Otherwise, it really is the rapid antigen tests that the province has committed still to make available to children. And so that's happening still through community distribution sites and schools. But I don't have any indication that will change. I'm sorry, Chair, I did miss the other second part, sorry, of your question.
The other issue that is to vaccinations for children 5 and under.
Okay, yes, so children who are under 5 right now, there isn't a Health Canada approved COVID-19 vaccine for them. The next step after Health Canada approves something for use is the National Advisory Committee on Immunization makes a recommendation about how it should be used. We just don't have those options yet for children under 5. There is still research ongoing. We know that. We had expected to see some results of those trials and then applications for approval. But I think my understanding is they've gone from seeking an approval for a 2-dose series to a 3-dose series, and so it's taking more time. But we still are looking out for that, and we will be letting the public know as soon as a product becomes available. And then in Ontario also, we are administering vaccines according to the provincial program. So it's the Ministry of Health that sets the parameters for who is eligible for vaccines, and then we deliver that program.
Thank you for that clarification. Going to the list now, first is Member Tilley for questions.
No questions. Thanks for the excellent updates, Chair, and to the Medical Officer of Health, Dr. Etches. And yeah, glad to hear we're continuing with the focus on wellness at work and the focus on trying to get back to regular OPH activities someday, or carrying on now, but even more enhanced as we move through this pandemic.
Thank you, Member Tilley. Member Menard.
Thanks so much, Chair. Thank you very much for the update to Dr. Etches and to the delegation who came out as well. Hearing a lot of that being expressed to me about schools in particular and the concern that persists there. I did want to just hope to get some comments around the illnesses that we're seeing right now, because it does seem like there's a large amount of spread of COVID-19 in the community, but also other illnesses that seem to be circulating. Certainly anecdotally anyway, I'm seeing it. A lot of my friends are sick or their families are sick, and it seems to be a bit of a concern when it comes to workforce adjustment or school settings. And so I'm just wondering, maybe you can comment on that, the level of illness we're seeing in our community, and any advice we might have for people.
Yes, so I will see if someone from the epidemiology team has more of an update on schools in particular. We do look at that week over week in terms of absenteeism. We also look at the illness that presents to the Children's Hospital of Eastern Ontario emergency room in terms of the proportion that's respiratory illness, and how much of that. So I'm just inviting our epidemiology lead or spokespeople to join in. But what I can say is, yes, the COVID level is high in our community. And so it is the case that many people are getting illness that isn't sending them to hospital. And not everyone's testing positive on a rapid antigen test. The test is just not perfect. If you do it right away, it doesn't always pick it up. Sometimes if you're repeating, right? We know with a rapid antigen test, if you repeat it 24 or 48 hours apart, that's more likely to increase detection of COVID. Sometimes it shows up later on the repeat test. So just the implications of that really are to stay home when you're sick. Like that really is an important piece here. And we know as a board, you've advocated for people to have sick leave. It's truly one of the things that is an enduring need. Some of it is not COVID. So there are other respiratory viruses. We are seeing that. And unfortunately, we're also seeing gastrointestinal illnesses spread. So it's the close contact between people that's changed. It's the dropping the layers of protection with the masks, more gatherings indoors. It's not just COVID that's spreading. So it is important to keep following the measures of what will make a difference, especially for people who are more vulnerable. I just want to see if anyone had joined in to speak more to the school situation. Maybe we have to bring them into this actual panel, I think. So I think, anyway, if they can't join, what I saw the last update on schools was actually the situation is stable. The proportion of absenteeism greater than 30% is fairly stable. After it rose, it rose in March. And then it's more stable now. And the...
I'm here.
Oh, Amira is here. Okay. Sorry, Amira, go ahead. Yeah.
Okay. Good evening, everyone. So as Dr. Etches started to speak about the absenteeism, we did have an increase in absenteeism over the past 3 weeks following March break for both staff and students, after it had been stable since the middle of February. With respect to the respiratory visits, we do have access to a consortium of syndromes, so respiratory influenza-like illness and group for people presenting to the emergency room visits, and for 0 to 4, 5 to 11, and 12 to 17. And looking at the data from the past couple of weeks for Ottawa, it has been relatively stable. It has increased certainly since the middle of March, but for the past few weeks, it has been relatively stable.
Thank you very much for that. I appreciate it. And if any of the board members have questions about the motion we put forward, appreciate staff's help in crafting this to make sure that we as a local health board have a little bit more flexibility than we do now to maneuver as this changes over time. and as different settings present different risks. So I appreciate any questions come that way. Happy to answer anything comes my way. Thank you, Chair.
Thank you. Member Lakin.
Thanks, Chair. I just sent you a question, so I'll just read it out to you, which is, have we received, the reason for the question is whether I asked Dr. Etches now or later, have we received the strat plan update and we'll return to it, or have we received it and that's the end of it? Because I can wait. It's more appropriate.
We have received it with the will of members. We can but I think we should finish this portion first, Member Lakin, and then if everybody agrees, and I don't see why they wouldn't, we can add that question as the next item on the agenda.
It's not a serious matter. I didn't want to take things out of sequence, and it can certainly wait. But if there wasn't an opportunity, I was going to comment on it now. But otherwise, I can wait, and therefore have no questions to the medical officer at this time.
Yep,
Thanks.
no, we'll definitely come back to that, Member Lakin.
Super. Thank you so much.
Member Kavanagh.
Thank you very much. I had the pleasure of talking to Dr. Etches the other day, and it was a great opportunity to go in depth one-on-one. And so I don't feel like I want to ask any further questions. I feel pretty satisfied with the responses I received. Thank you.
Thank you. Member Gower.
Thanks, Chair. Can I ask questions to Dr. Etches and staff about the motion that's in front of us? Is that in order now?
Yes, motion's on the table. Absolutely.
Okay, thank you. Well, let me start with this, Dr. Etches. There's a few things in the motion. One of them is about the ability for medical officers of health to issue letters of instruction. Can you talk about to us how that would or would not be helpful from your perspective?
Yes. So certainly throughout the experience of the pandemic previously, it was a tool that local medical officers of health used to adapt to particular situations in a local jurisdiction that might have needed attention, say, compared to a province-wide initiative. Certainly these waves that we're experiencing are province-wide, so the province-wide tools are most important, but there can be times when a local action is needed, and so it's something that is easier to use in terms of it's a straightforward measure that I think we found it easy to write up letters of instruction and disseminate them in a rapidly, so it could be something that was useful in the future. I guess for context, I do see that we are in a time where the need for direction and mandate to manage is diminished, given the level of immunity we have in the population, and also really given how people are feeling. So we know there are some people who are very concerned that some of the protections that were helping community-wide have been removed, and especially people who are immunocompromised. And we know there are others who are completely tired and feel protected themselves and don't see a reason why they need to wear masks anymore. And so, the buy-in and the ability to proceed with things that are required is also diminished. What I hope we can continue to do as a community is think of how our actions affect others and continue to choose things that will protect people at greater risk for severe illness. And then be prepared to do that as the COVID levels high, as the COVID level changes. So I think this is what we see into the future is needing to know what the situation is, know what will increase protection for you and for others, and choose those approaches and support employers to choose those approaches over time.
Again, on the motion, there's an ask to the province to increase promotion about vaccination. Where do you see, or do you see some gaps in the communication at provincial level, or how would that help OPH or our local situation in Ottawa in particular?
We know there can be efficiencies with provincial communication strategies rather than each local area needing to invest in a big communications campaign. And there can be an additive kind of impact of people hearing the same message from the province as they hear locally. So I would welcome more promotion of the value of vaccination for people to understand, because they see people who are vaccinated getting sick. Why do we still think you need a vaccine? Well, there's good evidence it still protects against transmission to others and against severe illness. And so really amplifying that message could be important at a time like this when things are high, and to provide protection into the future.
You had mentioned earlier, I think you said Ottawa has a higher vaccination rate than any other large city in Ontario, which is good. When I looked at the dashboard today, it still seemed like the numbers for third dose for teenagers was under 30%, and even second dose for 5 to 11-year-olds was just over 50%. Like, to me, those numbers seem low compared to other age groups. Do you know how we're doing compared to other cities in Ontario with some of those second doses or third doses where the numbers seem lower? I'm trying to understand, I guess, the context or comparables.
I think we have the second highest coverage rates among people 12 to 17 with 2 doses, and 5 to 11 with 1 dose. Even the 2 doses, like we're close to the top or second in terms of coverage rate, maybe still the top city that's larger for sure. So it's a widespread province-wide challenge that for some reason for teenagers and for younger children, people are not following through on the next dose. And again, I think we have to understand that and look at why people are making these decisions and try to help people understand the value of the next dose.
Okay. Yeah, I'm digging into some of these because we write a lot of letters and we've had a lot of motions over the past few years. And I think every time we do that, we have to make sure it's something that would actually be useful and helpful for the situation here in Ottawa and province-wide. So I just wanted to better understand where some of these items would be beneficial to our efforts in managing our COVID reality here in Ottawa. So thank you for the information.
Thank you, Member Gower. Vice Chair, over to you.
Sorry, I lost my mouse there to unmute. So thank you. Lots to unpack. I really appreciated the updates and really appreciated the updates about the activities around as part of the recovery for OPH. It's a major undertaking to get things ramped back up. And so really appreciate that update for the board, as well as, of course, all of staff's efforts to do that. And I also really appreciated all of Member Gower's questions, because I was wondering the same about what's being recommended here in terms of advocating for to the province, and making sure that this is a valid piece to put forward, that we're not wasting an effort to speak. And I guess my question, which I just didn't understand, and was around the high priority community funding. Could you explain a little bit about that? I'm not sure how it works, and then what's being asked particularly.
Yeah, the Ministry of Health, in recognition that there are some, actually, I would call them forward sortation areas. They're using a rough measure of a community and neighborhood geographically that have lower coverage rates and higher rates of COVID infection. And they therefore invested in a program called the High Priorities high priority communities program, where they made funding available to groups to apply that would support more intensive work in those neighborhoods to provide services and supports that aren't necessarily as robust usually. So more access to social services supports, to primary care supports through community health center, to the testing and the treatment and the vaccination. So in Ottawa, there's only one neighborhood where this service is being provided through the Southeast Community Health Center. And I think you've heard, like you know, we're working in many communities we would consider high priorities. And so this is about being able to extend the program in time. Also, it's temporary funding, and then expand the program to others. So it wouldn't be funding that Ottawa Public Health would necessarily take and receive, because these are more comprehensive primary care and social services, often provided by a healthcare partner or a community partner that could really be in the community meeting those needs.
I see. So we believe that there's other communities in Ottawa that would really benefit from this wraparound service, but they don't currently not qualifying for it.
Right.
Okay, excellent. Thank you so much. No further questions.
Oh, I see Aaron came on. So Aaron, happy for you to add anything about how it's working now or anything you'd like. Yes, Aaron Saluski.
Hi there. Hi there. Thank you. Yes, well, thank you, Vera. And I think the one piece I would add is some of the neighborhoods that we're seeing that while we have received services and vaccination services in the rural areas, looking at adding more intensive approach into some of those areas, seeing that those values and the vaccination coverage rates are much lower.
Thank you.
Thank you, Vice Chair. Member Cloutier, please.
Thank you, Chair. Like Member Kavanagh, I had a good one-on-one meeting with Dr. Etches earlier in April, and I have no other questions. Thank you, though. Thank you, Dr. Etches, for the update.
Thank you. And last but not least, missions.
Hello, from Aria and I. She decided to join. So first off, I want to say congratulations, Dr. Etches, on your award. And wanted to thank you for everything that you do. I know you highlighted some of the things that you are currently doing. And also,
Hi, Aria.
She lost her meeting privileges. She's been kicked out by the speaker or something. So I also want to thank you. I know May 4th is Maternal Mental Health Day, and you're coming to speak at Flora's Walk happening in Lansdowne. So thank you for all you do for the community and that outreach work that you continue to do on behalf of our community. In relation to the motion, I had a couple questions that are a bit historical, I guess, in nature, but I think that they would maybe help me better understand what the likelihood of writing to request being able to reinstate your ability to write the letters forward moving. So I'm wondering if you could discuss a bit what the exact change in the legislation is. It doesn't have to be verbatim, but in terms of what you used to be able to do versus what you can do now, and whether there was any consultation with whether it be various boards, chief medical officers of health, and if there's been any opening to any consultation since that power has been removed.
Oh, I do see I'm off mute. I was going to invite Omar Ansari to speak to this because he's been following the regulatory changes recently as the Reopening Ontario Act has been sunset. I think it does change the context for letters of instruction. There may need to be something different put up in place. I don't know, Omar, if you're there. Yes, you're able to speak more to that.
Yes, just echoing what the medical officer of health has just said. in a nutshell, at the end of March, what happened was the province didn't extend their ability to renew or amend orders under the Reopening Ontario Act. So in effect, where that puts us in as far as if the province is to reintroduce the ability of local medical officers of health to issue letters of instruction specific to COVID-19, that would put the province in having to introduce new legislation. So that's the short answer. And also effective, well, tomorrow's the last day for the Chief Medical Officer of Health to issue instructions. But that's on a separate note. So.
And so was there any consultation as to whether this was a power that was useful or that people voiced they really wanted to continue? Is there anything that you can share there? Or I'm just wondering, I guess, did the province kind of knowingly remove that power with consultation amongst the key stakeholders? And is that door open at all? Or are we requesting something that really, I'm assuming the legislature is about to adjourn prior to an election, and the soonest they'll be able to introduce that legislation will be in the late fall when they resume sitting?
Yeah, there's a few things there. I think there wasn't consultation when the power was removed. We did use it across the province, different local medical officers of health, so it had some value. I think probably Member Menard, you can speak to the rationale for putting something forward now. For myself, I would say that we know we're still living with COVID in our environment. We're still going to need to respond to it in the, hopefully we have a quieter summer, but into the fall, most likely. So I think that kind of discussion you're talking about, Member Banham, in terms of field and province together, what worked, what's needed, these are valuable questions to work out ahead of the next resurgence.
And maybe Omar, am I correct in saying that if they would need to table new legislation, that is unlikely to be able to happen until post-election at this stage?
Ultimately, it's in the province's, the government's hand. So I can't foresee what position they're in, but you're right. There is an expected election date, and that necessarily would affect any timeframes. So I can't say for certain.
Okay, thank you. Otherwise, those are just some of my questions regarding that, and others have asked my other questions. So thank you so much for your update, and to the delegation, and no more questions.
Thank you very much, Member Banham. I just have a quick follow-up question, Dr. Etches, on the motion. I know that OPH staff worked with Member Menard and his staff in putting this motion together. You've now heard a number of questions from Member Gower, Member Banham, Vice Chair, around the motion. Speaking on behalf of staff, are you still content that this is an operational motion, something that you can work with if we pass it tonight, or do you think there's some things that should be changed based on the feedback you received so far with regard to the motion?
I think it's really a question for Member Menard. I guess that specific language about issuing letters of instruction, perhaps what we're trying to get at is to be able to take local action, to provide local direction. in a way that is simpler, or I do like the idea of reviewing what is the best tool. But
Happy to jump in, Chair, if you'd like.
I'm just going to go to Member Gower first. He had his hand up, and it may be related to the motion as well, and then you can sort of respond to all the pieces.
Yeah, I was going to ask if the mover would consider removing, I think it's the third whereas that refers to the province prematurely removing mask mandates. I find that to be quite a statement, or quite a something for our board to be stating, and I'm not sure it's supported necessarily in objective facts here. So notwithstanding some of the comments that Dr. Etches just made on the therefore be it resolved, it's just that third whereas that I'm hoping could be removed from the motion before we vote on it.
I see Member Bam's asked for the motion to come back up again. Probably makes sense to look at the therefore be it resolves. As you know, Member Gower, the introductory clauses aren't part of the actual action items that happen. Certainly that is in the whereas clauses, absolutely a statement that I think is accurate based on what we've seen in the sixth wave with the very high wastewater signal that we've had, as well as the comments that we've heard from our own OPH staff to whether it be the school boards or in highly recommending people to wear masks indoors, particularly in high-risk settings. And so I think it is fair to say. With regard to the be it resolves, I'll just mention, I know some of you certainly follow other boards of health, and City of Toronto has recently passed a very similar motion and has indicated very clearly that they want to see these local letters of instruction come back as part of the local toolkit. And so I think, certainly the Medical Officer of Health may issue written orders under Section 22 of the Health Protection and Promotion Act. But this is different. We did issue letters of instruction. I'm sorry, my son's just walked in. Sorry, buddy. Just got to finish up. Okay, I'll be right with you in like a few minutes. Okay. Okay, I'll see you in a few minutes. Close the door, please. Thank you. Sorry about that.
Nothing to be sorry about.
I apologize. So just to say, we've had the largest board of health in the province pass a similar motion that has requested this after the power was removed by the province to impose those letters of instructions around these issues. And so, depending on how things go in the near future, it is important, I think, to ask for those powers to return. And so, I hope that we can pass this motion tonight. Based on that kind of importance of the future variability of what we've seen with this virus, and the need for having local solutions without having just a broad provincial oversight that often doesn't suit local areas that may be experiencing outbreaks in other settings. So hopefully we can pass that, and the other portions of the motions that OPH has assisted with. Really very much appreciate staff support on those aspects. Thank you, Chair.
Thank you. I have a question for the board secretary before we go to Member Gower. It seems that the mover is not prepared to remove the whereas. I'm wondering, I know we can vote separately on the therefore be it resolved clauses, the operational clauses. I suggest maybe we do that in light of the discussion we're having tonight. Are we also allowed to vote for or against the whereases?
Chair, my suggestion would be that Member Gower or another member who's uncomfortable with that whereas clause could move a motion to remove it. So that would require a vote on the motion to amend, and then we could call separate votes on the three therefore be it resolved clauses. And I'm open to having Omar weigh in if he feels that something else is more procedurally appropriate.
Omar, anything
Chair.
to add?
Nothing to add.
Okay, so we have a way forward, if you will, on this issue. I'm not weighing in at this point one way or another as to the vote itself, but we have a process. I don't know. So, Member Menard, you're content with the wording of your motion as is?
Sorry, Chair. Yes, I believe the whereas clauses certainly speak to my motivation, but the intent and the action items are in the therefore be it resolved, which I think general there's agreement around the table. So I'd like to pass that as it is in terms of the therefore be it resolves. We can debate the mask mandate and the removal of that in settings like grocery stores and schools, where we've had major concerns from people at that time when the province did that. And I'm happy to have that debate if we want to have that motion on the floor. The action items, though, I think speak for themselves, and hopefully we can get behind those. So appreciate the opportunity.
So just two quick things. So Dr. Etches, are you still okay with the operative clause dealing with the letters of instruction, or you seem to be thinking of perhaps somewhat different language?
Well, I didn't think of this earlier, but perhaps it could be letters of instruction or other similar powers. Just knowing that the context has changed.
Would you consider that a friendly change, Member Menard?
Yes.
Okay, so perhaps the motion could be changed to reflect that before we vote. Board Secretary Diane and Member Gower, before we move to voting on the motion, are you going to follow the procedure set out by Deanne and Omar to put forward I guess, an amending motion or a replacement motion, or do you want to leave it as is and vote separately on the operational clauses?
I'm thinking carefully, so I'm not really interested in prolonging this discussion. In general, I agree with the spirit of the motion, but I am concerned because these motions do form a statement of our board, and I'm not entirely in agreement with that third whereas. So, Chair, I think I would move that we delete that third whereas before we vote on it. So I would so move that therefore be it resolved the third whereas be deleted from the text of the motion.
Okay, so two things, I guess. Zian, before we, that amendment, if you will, has been tabled, Member Banham had her hand up to speak to the original motion. I'm assuming we can go to Member Banham to hear what she has to say about the motions before we vote on the amendment?
Yes, absolutely, Chair.
Okay, so we'll go to Member Banham then, please.
I just had one more question, and it sounds like Dr. Etches, you are getting more comfortable with the language, but I just had one question because I think it deserves to be said as, you know, the oversight over OPH and the fact that we talked a lot about wellness. One of my largest concerns about localizing some of those decisions is that it puts a target on local public health officials such as yourself and others when we are doing different things than the province is maybe mandating. And so I just wanted you to maybe chat about the risk level of taking that back on at a local level, and or whether there are any concerns about that.
So I'm going to speak for myself, but it's really Ottawa Public Health as a whole. We all work together, epidemiologists, you know, our specialists, in looking at the evidence of what needs to happen locally. We do appreciate being able to act locally when the hazard or communicable disease is local. And we understand that really a pandemic is mostly provincial, but there are times when there could be something happening locally. So I think having the option is useful, knowing that we've learned that consistency across jurisdictions is also important for people and employers who cross boundaries. So, I think our leaning is also still, for this type of province-wide impact, it's going to be provincial. But I think it's a tool, that could have its place. Again, I think the whole context being that we're not really at a point now in this pandemic to lean on directives and mandates, but there could come a time, again.
Okay, thank you for that. I note that Member El Shantiri is in the meeting now. Thank you, Eli, for joining us. We're just, Eli, I don't know if you've been listening in.
I have been in the last 10 minutes or so, but not before that.
And just to bring you up to speed, we're in the process of dealing with Member Menard's motion then, and you've seen the motion. Because we can put it back up on the screen if you like, Eli.
I would like that, Mr. Chair, if you don't mind, because I see you have changed some amendment to it. Is that what I heard?
Not at all. We'll just take Dr. Etch has suggested an amendment with regard to letters of instruction, and I don't see the change in that wording yet. If you can remind us, Dr. Etch's letters of instruction and
or similar powers.
So we'll need that added in before we vote on it. And then Member Gower has brought a replacement motion. He's concerned about, I don't want to put words in your mouth, Member Gower, but your concern is only around the whereas clause dealing with whether the masking mandate was removed earlier than it should have been, correct?
That's correct.
So you just want to remove the third whereas from the motion. Other than that, you don't have a problem with that, correct?
That's correct, yes.
Okay, so the motion on the floor then, Eli, is first to vote on the amending motion, which indicates that the province prematurely removed the mask mandate in essential services settings such as schools, indoor spaces where people work closely together. Member Menard has indicated he's not prepared to remove or modify it in any way. If I can suggest, and this, Zian has made a suggestion to me that a way through this perhaps might be, I'll just put this out there before we vote, simply removal of the word prematurely. And before we go to you, to Member Menard, would that satisfy you, Member Gower?
Yes, I think it would, Chair. Yes.
So Member Menard, it's a bit like a tennis game here. Lob it to you. It still speaks to the removal of the mask mandate and the impact of that on the community. It just removes that one word. And I think if that is out, then your motion will likely pass with the slight change from Dr. Etches unanimously. And if not, then we're back to the to and fro on this.
Well, Chair, I'll just say I hope the motion passes unanimously. Regardless, everyone has their vote; they can vote the way they want. But I hope it passes regardless of whether or not we make the change to the whereas clause in terms of the operative clauses that I've also agreed to amend based on Dr. Etch's comments. With regard to the word prematurely, look, that we are appointments here that are sent to do a job with local health and also have political opinions and views of things. I will just speak to the issue of why I believe mask mandates were removed prematurely in the motion. If you look at the whereas clause there, what I speak to is that the province of Ontario prematurely removed mask mandates in essential service settings, schools, and indoor spaces where people work closely together. Those are areas where I've indicated in the motion. The head of Ontario's Science Advisory Table has also said it was too early to lift mask mandates, and that the infections that we were seeing, the removal of mask mandates had an effect on those. And they continued to call for a revisiting of that decision in Ontario. Our medical officer of health, when this decision was made, has been on CBC and other areas saying, strongly recommend wearing masks indoors or where you're feeling there's a high risk, you're feeling high risk settings. And so in high risk settings. So there is, think very carefully about how we're going to vote on this, because certainly the operative clauses of what we were debating, but now this debate has turned to something else, to turn to this other piece around the word prematurely. This is my motion. I personally believe, you don't have to believe in every single whereas clause in here, okay? But it's a motion that I'm bringing to defend what I'm saying, and that therefore be it resolves. And in my view, after having read what the Canadian nurses have said, what the RNAO has said, what the Dr. Uni has said, the Ontario Science Advisory Table, it seems that there could have been prevention of the spread of this virus had we kept mask mandates for a little bit longer in several different settings, which I outline in the motion. And so I would just think very hard about how we vote on this, because it is a statement. It's too bad it's coming down to this, that this is the debate. But this was my motion, and I believe that it's sound to say that these were removed prematurely in some settings. Thank you, Chair.
Thank you. Member Lakin either has comment or question on the motion, and then we'll go to Member Banham.
Thanks, Chair. It's just a procedure question. Should we be unable to resolve this immediately, prior to putting Member Menard's question to the board, will we have opportunities to ask Member Menard a question about the nature of his objection more fulsomely?
Yeah, I don't have a problem with. I mean, the motions are intertwined. That we're talking about the same motion. Really, we're just fighting about a word. So yeah, no, I think we can debate and discuss both of them at the same time. But when it comes to a vote, we will be voting on Member Gower's motion before we vote on Member Menard's motion. But I think questions to either or both of the movers of the motions at this point would be fine.
Okay, would you like the question now then?
Yes, yeah.
Okay, so thank you, and thanks for the opportunity to speak to it. Member Menard, if I could just dig into the nature of the concern with the word premature. And I want to understand this, because because in your view, it may not reflect the will/view of the board in its majority, or it is scientifically incorrect?
I'm trying to understand the question. I'm sorry.
I'm sorry, my bad. I shouldn't have asked this question to Member Menard. It was to Member Gower. Excuse me.
I just don't think it's an objective term. And as a board, I think we should be as objective as possible in the motions that we're considering and voting on. So that's my concern.
Okay. All right. Thank you.
Another question, Member Lakin?
No, it therefore frames it a little bit better for me that the question therefore is, does it reflect the majority opinion? Because it's not objective as in factual. Does it reflect the majority opinion of this board? I have a better understanding. Thanks.
And we'll find that out when we vote, I guess.
Yes. that's
Whether
a
it
good-
reflects
good.
the opinion or not. Member Banham.
I guess my comment on the word prematurely is that it does create, as Member Menard said, a very political statement. At the same time, in the asks at the bottom, we are asking them to provide our local unit with more powers or restored powers. And while I respect Member Menard quite a bit, as he knows, I have a bit of an issue as a community member who is not a political member to say that while this is your motion, it is a motion that you are asking all of us to take on. And so it has to become a feeling or a political intent that we all agree on. And so respectfully, I challenge that, we will have this vote, but this would not be reflective of solely your political opinion. I guess to bring it back to that, your intention of your motion, it would become our motion. And so I just wanted to put that out there, that we are asking them to give us restore powers back at the local level, and at the same time putting a very political statement into it. So I think that's why prematurely is a one word that we are arguing for this length of time on, even though it is only one word.
Thank you for that, Member Banham. I'm looking at the speakers list and I'm looking at the time. So I think I'm going to have to ask you to move the motion to extend time past 7 o'clock. We have at least 2 more speakers on the list, and then we have to vote on 2 motions. So if you could please move that motion. So Member Banham.
Sorry, I'm having mute issues here. As always. Sorry, we're voting. Can you repeat what we're voting on?
Yeah, it's you're moving the motion, right? Or I'm asking you to move the motion right now to extend time past 7 o'clock.
Sorry about that. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant of subsection 8(1)(c) of the procedural bylaw. Apologies.
Thank you. Carried?
Carried.
Great, thank you. Okay, we'll go back to the speakers list then. And on my screen, I see Member Tilley first.
Yes, thank you, Chair. My thoughts are similar to what's been said, is that I think the word prematurely brings it into the subjective. I know I appreciate Councillor Menard has heard expert opinions, some saying definitely it was premature, but then again at the start, I do remember, I can't remember if it was the medical officer of health for the province, but someone saying they also supported the political decision. So my question would be, if we're putting this forward as a board, and I wouldn't want to put Dr. Etches and the staff in a position now, if they haven't had that discussion, I want to make sure that what we're putting forward as a board is also the position of the staff, that it was premature.
Is that a question, Member Tilley, for Member Menard or for Dr. Etches on behalf of staff, or
for Dr.
simply
Etches.
A comment for Dr. Etches?
For
okay.
Dr. Etches, is this the position of the staff as we crafted this motion, that the removal of the mask was premature?
I think it depends on what outcomes you're looking for. So it certainly is the assessment of our Chief Medical Officer of Health that we are managing through this resurgence, balancing the different needs that people have at this point in the pandemic. So, I think it depends what you're looking for. For those who feel that they are immune and the masks are a challenge, it wasn't premature. For the others who are concerned that they've lost the protection of people around them wearing a mask when they are immunocompromised, it was premature. So I think as a board, it's really, it depends what you were looking for there in terms of balancing the different perspectives. I do think that masks are important to control transmission of COVID. They're probably not the tool that are making the difference in terms of whether this resurgence happened. We see that with Quebec, and they've maintained the masks. We still have the resurgence there. So it's different layers of protection that needed to be in place to really decrease the transmission. The number of close contacts that people have is probably the biggest driver, and people having contacts when they're sick. So it's all of these things that are important to pay attention to decrease COVID in our community.
So my further comment on that would be I agree with what.
Does that help, Member Tilley?
Well, yes, but I agree somewhat with what Member Banham said. With all due respect, Councillor Menard, is that on the one hand, we're going forward to the province with an ask, and sometimes even one word can just skew the message if the focus becomes on that.
Okay, thank you, Member Tilley. Vice Chair.
Yeah, far be it for me to repeat what others have said, but I would like to speak in favor of removing just the word prematurely. I feel just even the conversation here, it introduces ambiguity into a statement that people can read into it what they will. And the motion is well written, Member Menard. It stands alone factually. I think she's what you want to say by going on to say that as it's written, thereby increasing the risk of transmission prior to a sixth wave of the virus. I think that achieves what you were looking to put out there in terms of the role of masking as one layer of protection, and yet is less ambiguous in terms of the intent of the board, because there obviously is different meanings, and when we're going to ask for powers, as Member Banham put forward, it feels like we're inflaming the situation in a way that just doesn't strengthen the motion. So I'd be sure where we are with the moving, but for taking out the word prematurely.
No, the comments in order, Vice Chair. We're going to vote on Member Gower's motion, or I guess we'll call it replacement motion or amending motion first. I just want to make a couple of comments, if I may, before we vote and before we allow Member Gower wrap up on his motion. I think the intent of this motion is good. And I understand the place that Councillor Menard is coming from. I've had this discussion with Dr. Etches on many occasions, and I appreciate her candor that tonight in answering Member Tilley's question, because it's again, we have had this discussion, and there are factors over and above masking. There's gathering, lifting of the restrictions on gathering indoors, concerts, hockey games, that sort of thing, that are impactful in terms of spread. There is the nuance, the very real factor that the wearing of masks, or the imposition of wearing of masks, has impacts on people's mental health. The taking away of masks has impacts on people's mental health and on spread. So it's not a simple matter, but it is a good motion. And I think what Member Menard, if I can speak to you directly, I think what we're hearing is there is widespread support both among staff and members of the board, both elected and appointed, to support the operative portions of your motion. There doesn't seem to be any quarrel around that, especially with the additional change suggested by Dr. Etches around letters of instruction. I don't want to see this motion fail. You've put work into it, staff have put work into it, and I think it raises some important questions. But from what I'm hearing, and you never know until people vote, what I'm hearing is that there's support for the Gower version of the motion, which will in no way impact on the operative clauses, which is, as you said yourself, the whereases are not operative, they're not operational. The Gower amendment leaves the operational pieces as you want them to be, as you've proposed them to be, in force and effect, and has the benefit, I think, again, you don't know till the vote happens, but I think of having unanimous support from everyone around the table, both elected and not elected. And again, I appreciate Dr. Etch's candor and diplomacy, but if I can read between the lines, and she does not have to nod or agree, but if I can read between the lines, I think staff would be more comfortable with the removal of that word as well. So I'll leave it at that. I see that Member Kavanagh has her hand up. Then we'll go to wrap up by Member Gower, and we'll vote on his motion first, and then we'll depending on what happens there, we may or may not move to your motion. So Member Kavanagh.
I'm just double checking, Chair, that we weren't removing the entire whereas, we're just removing the one word. Is that correct?
That's what Member Gower is suggesting, just remove the word prematurely, yes.
Okay, I understand the attachment to that. It was my suggestion, and I just felt that nothing was lost when I read it. It's perfectly grammatically correct, and still gets the point off of something that was removed caused something else to increase, and I think that's more. I don't think it's hill to die on to have that word removed, so it'll still work, and we get our point across. Thank you.
Thank you. Going to go to Member Gower now for wrap up.
No further comments, but thank you everyone for the discussion and thoughts around this. Thank you.
So I think in light of the discussion and debate we've had, we should. I'll call on you by name to vote. So we'll have a recorded vote on this. Member Tilley. On the Gower motion?
Yeah, on the removal of the words as the
just the removal. Yeah, well. So to be clear, the Gower motion incorporates the removal of the word prematurely, and also incorporates the slight change the Dr. Etches made to letters of instruction.
Sorry, Chair, that's not. I don't believe that's how it happened. So the Gower motion is an amendment to my motion. It's not a replacement. As I understand it, unless you're saying it's a replacement, in which case this will change things.
Well, I'm trying to keep things as simple as possible. So I'll go back to Deanne and Omar, but it seems to me after all the discussion that we've had, there is agreement around the operational clauses with Dr. Etch's suggested change. The only concern on the motions is the word prematurely.
Yes, and I've accepted that Dr. Etch's change in the operative clause is all I'm saying. So the Gower motion is just on prematurely. The other operative change to that therefore be resolved was a friendly change and has been made already to the main motion, if that makes sense.
So okay, I'm gonna go to Deanne then and Omar. So if we vote on Member Gower's motion and it gets approved, do we then move? Do we have to move on to Member Menard's motion, or will the vote on the Gower motion incorporate both the removal of prematurely and the addition of the 2 or 3 words the Dr. Etch has added in around letters of instruction?
Chair, my understanding is that the proposed change about member of instructions or other local powers was accepted by Member Menard as a friendly amendment. Member Gower's motion is to remove the word prematurely. If Member Gower's motion carries, then we vote on Member Menard's motion as amended by the friendly amendment in the therefore, the second bullet under therefore be resolved, but without the word prematurely in the third clause. If the Member Gower's motion fails, then we vote on Members Menard's motion as amended by the few additional words in the second bullet under therefore be it resolved, which he accepted as a friendly amendment.
Okay, so if Member Gower's motion goes ahead and is approved, we still have to do a second vote.
On Member Menard's motion, which he has amended as a friendly amendment, yes.
As well, with a friendly and a non-friendly amendment.
Correct.
Yeah, both types. Okay, all right, we're good then. Okay, so I understand. Does everybody else understand what we're voting on? Okay, excellent.
And Chair, just to save time, maybe you could just carry it and I'll just dissent on removing the word prematurely because that's what I believe. So I'm not going to vote against my own beliefs. I believe it was removed prematurely. So maybe if you just want to carry it and I'll dissent or someone else wants to say,
okay, that's an option. The only thing I raised then, but then when we vote on the amended motion, are you then going to dissent against your own motion?
No, I'll if you want me to, I'll carry that. I want to see the operative clauses carried. I just, that's fine. I just personally do not want to accept the fact that it wasn't removed prematurely. I'll vote against that, but then I'll vote for the main motion, which is my motion.
But the main motion will not have the word, if that's the case, the main motion will not have the word prematurely in it.
Yes, I understand that, Chair. I understand.
Okay, I just want everybody on the same page. So just before we call the vote then, sorry, Member El Shantiri has his hand up.
Well, I'm just going to say, Mr. Chair, you already called for the vote. Well, let's take the vote and let the members vote as they wish. Doesn't matter whether.
Okay, no, that's fine.
You would accept if you would accept.
I think we will do a recorded vote though, just so there's clarity. So on Member Gower's motion to amend, Member Tilley.
I support that. I approve.
Member Menard.
No.
Member Lakin.
I applaud Member Gower's drive for objectivity, but in this case, it is my opinion that it is premature, so I do not support the.
Fair enough. Member Kavanaugh.
Yes.
Member Gower.
Yes.
Member El Shantiri.
Yes.
Member Giovanni.
Yes.
Vice Chair Giovanni.
Yes.
Member Kuche.
Yes.
Member Banham.
Yes.
And myself, yes. So now we move to vote on the amended motion of Councillor Menard, or Member Menard, sorry. So we'll, since we had a bit of a split vote, we'll go through it again. So Member Tilley on the amended motion.
Yes, I support the amended motion.
Member Menard.
Yes.
Member Lakin.
Yes.
Member Kavanaugh.
Yes.
Member Gower.
Yes.
Member El Shantiri.
No.
No, okay. Member or Vice Chair Giovanni.
Yes.
Yes. Member Kluche.
Yes.
And Member Banham.
Yes.
And myself, yes. So both motions pass. Now, if everybody agrees, if you don't agree, please raise your hand. But if everybody agrees, we're going to go back. We're going to add back in item number 6, as Member Lakin had a question related to it. Is that satisfactory?
Oh.
Okay. Member Lakin.
Wait a sec, I forgot. No, I'm just teasing. Simply, Mr. Chair, I apologize. It wasn't a question. I just wanted to make a comment for the benefit of the board on an item that was in the strat plan update. related to priority one, innovating mental health. I read it with interest, Dr. Etches, and as a member of the board, I really want to applaud the work on promoting the mental health initiatives, particularly in light of the distraction of COVID. And one item in particular I want the board to be aware of, which is the neighborhood hubs, the mental health neighborhood hubs initiative. I just wanted to commend staff and shout out particularly to the mental health group. It really represents a targeted, rigorous, methodologically sound public health intervention upstream that is something that public health can do for mental health. Normally, public health doesn't get in the business of administering mental health services. This initiative, I think, really speaks to how public health can effectively intervene in the community's mental health. And I just wanted to publicly applaud it and bring it to the board's attention to read again if they haven't already. Thank you. That's the end of my remarks, Chair.
Dr. Etches, any comment on that?
Well, gee, we've heard from the community where we've been providing neighborhood vaccination hubs that there are other needs, and that mental health and substance use are top concerns. So this is our attempt to contribute to meeting those concerns, knowing that it takes partners where we're not psychiatrists, for example, and I think psychologists. I think that we are seeing promise of being closer to populations, reflecting populations and who is on our team there in the community. So I do appreciate the effort that's gone into starting this. I think it's a start, and we'll see and learn from it.
Thanks for that, Dr. Etches. We're back to the main agenda then, and the next item on the main agenda is motion to adopt reports. Moved by Member Bannon, please.
I don't know if it's going to come up. There we go. Okay. Be it resolved that the chair of the Board of Health verbal report. This is parenting in 2022. Apologies. The medical officer of health verbal report, and the report's titled Board of Health Policies and Bylaws 2022 Review and Updates, Participation in the Association of Local Public Health Agencies, Alpha 2022 Annual General Meeting and Conference, Emergency Management at Ottawa Public Health Annual Update, Ottawa Public Health Strategic Plan for 2019-2022, Update from Q4 of 2021 Operating and Capital Budget Year-End Results, Board of Health for the City of Ottawa Health Unit Status Report, and Delegation of Authority contracts awarded for the period of July 1st to December 31st, 2021 be received and adopted.
Is that carried?
Carried.
Thank you. Are there any motions requiring suspension of the rules of procedure? Okay. Are there any notices of motion for consideration at a subsequent meeting? Okay, seeing none. Member Banham, if you could introduce the confirmation bylaw, please.
Absolutely. Be it resolved that confirmation bylaw number 2022-3, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of April 25th, 2022, be read and passed.
Carried?
Carried.
Thank you. Are there any inquiries? Okay, I will adjourn the meeting. I just wanted to say thank you for everybody. That was a lively discussion and debate. But I think that it was reasonable in terms of working out what we wanted to say as a board and how we wanted to support Dr. Etches and her team going forward in their interactions with the province. So I want to thank you all for that debate and that dialogue. I think that that was important, and again, it was civil and respectful. So you know, as a chair, you can't really ask for anything more in terms of discussion of an issue at a meeting. So thank you all for that. Our next meeting is scheduled for June the 20th. Before we close, I just want to remind any media who may be watching this meeting on the YouTube live stream that we will have a Zoom media availability 15 minutes after adjournment. This replaces the post-media scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. That's it. So we'll see everybody in June. Thank you very much, and have a good evening.
It will be about 10 seconds and like no worries about the your your usual. Just go ahead and do your thing. Okay?
You got it. Good evening, bonsoir. Je m'appelle Maxime Lee et je serai votre modérateur aujourd'hui. My name is Maxime Lee and I will be your moderator today. Thank you for joining us for this evening's media availability following the Board of Health meeting. Merci d'être parmi nous à la suite de la réunion du Conseil de santé cette année. On the call this evening, we have the Board of Health Chair, Councillor Keith Eglai, as well as the Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches. In addition, we have Andrew Hendricks, who is the Director of Health Protection at Ottawa Public Health, and Cameron Keys, the Director of Knowledge Exchange, Planning and Quality, who will be available for questions afterwards. Ici, durant cette soirée pour vous, nous avons le président du Conseil de santé, le conseiller Keith Egline, ainsi que la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches. Nous avons également le directeur de la protection de santé à Santé publique Ottawa, Andrew Hendricks, et Cameron Keys, le directeur du secteur d'activité de la planification, de la qualité et de l'échange de connaissances disponibles pour les questions par la suite. I'll now invite each media agency in alphabetical order by outlet to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique selon l'agence et chacun pourra poser une question ainsi qu'une question de suivi. For CBC Ottawa, we have Sarah Frizzle. Sarah, over to you.
Hi there. Can you guys hear me? Great. Dr. Etches, you noted a small uptick in hospitalizations this week, and I know the sixth wave, there had been kind of this rhetoric that the hospitalizations were delayed. Do you see this as a trend that's going to continue, or as we've already reached the peak, not as much of a thing to worry about?
Well, of course, I wish nobody would have to end up in hospital with COVID-19. So I don't want to make light of the fact that there are people in hospital at all. The trend that we watch most carefully is how many new people are being hospitalized each week. So this last 7 days, there were 22 new people hospitalized, and the 7 days before that, it was 25. So we really are seeing a very stable picture when it comes to hospitalizations. I'd like to see it decrease. It's not decreasing. Usually that hospitalizations will decrease after we see that turn in the wastewater. But it takes some time because hospitalizations show up later and then people stay in hospital for a while. And so the number of people in hospital is higher as people stay. And unfortunately, also that intensive care unit, result comes a bit later. So I do think that we will see still some higher numbers in hospital before we start to see a decrease. And I want to thank people for, what I see out there in the community. People are taking care, wearing masks. Some people aren't. They're being understanding about the situation we're in. Thoughtful about accepting the different practices around. And I think it is the attention to those who are at risk of severe illness that we need to maintain as we get through this period of high COVID in the community.
Thank you. And then my second question was on a motion that was just passed in the meeting. I was hoping you could give me a little bit more clarification on the letters of instruction. When was that power lost by the city? I was reading some different things that it was just for like sports and recreation versus all mask mandates at all local in all local institutions. I was just hoping you could give me some clarity there, and when the last time the city actually had a local letter of instruction.
Thank you. I'll probably have to follow up with you to get the exact date. When we do have a place on our website, though, maybe staff can find that for you right now, where we list the rescinded orders and letters of instruction. So those are rescinded. But also our legal counsel is reminding me it was the end of February. So it was a provincial change to the Reopening Ontario legislation, and it basically removed the possibility for medical officers of health locally to issue letters of instruction. Those letters of instruction were different in different localities based on gaps that we were seeing locally, whether it related to a particular type of business and needing to have more physical distancing in a business that was higher risk, or whether it included wearing masks in crowded situations that were outdoors, like on surrounding a skating rink. So there was some local variability in terms of what they were used to address. In Ottawa, they were never used to institute the mask requirement across the board. So in Ottawa, it was City Council that first passed a bylaw requiring mask use. And then the provincial regulation came in requiring mask use in indoor settings and workplaces. So mostly it was used to refine some of the instruction to businesses. Does that answer your question?
It does, thank you.
Thank you very much, Dr. Etches. Thank you very much, Sarah. Next up, we have Ted Raymond with CTV Ottawa. Ted, over to you.
Hi there. Thanks for taking our questions again. This question's for Dr. Etches, I believe. I'm not sure if Chair Egley is more appropriate, but my question is about the temporary employees you mentioned in your presentation, Dr. Etches, how a lot of them are going to have their kind of their work phase out by the end of the year. Do you have a number on approximately how many workers you had to bring in, and then how many are going to have to leave?
I'll describe to you the situation and then see if that answers your question. So normally the base budget for Ottawa Public Health pays for about 500 full-time employees with Ottawa Public Health. And actually it's about 700 people because we have some people that work part-time. What we went up to in the peak of hiring, especially hiring to work in the vaccination clinics, was an additional 3,500 people. But many of those people were working in other settings, other healthcare settings, and they were coming and giving us a couple of shifts in the vaccine clinics. So most of that 3,500 would be what we call casual employees who weren't relying on us for full-time employment. And we very much appreciate people really often going above and beyond to give that time and make a difference with us. There were about 600 full-time temporary people at the peak. Again, not just for vaccination, but for case and contact management, for working on infection prevention and control, helping with communications. All of these things required more people, and certainly, this was life-saving work, and we're just so thankful. And the demand across those areas is decreasing. So I'm not sure yet exactly what number of full-time people that we'll need, but it won't get right down to the zero. So our budget that was supported by the Board of Health is not to return to our base of 700 people. We expect that we'll need about 30% of the capacity that we've been spending on the COVID response right through the end of the year. So exactly how many casual staff will continue to work in those vaccine clinics, for example, we expect through the year. I'm not sure in comparison to the full-time temporary, but we are trying to prioritize keeping people who've been with us full-time because we know that is expertise and that they've built up, and we don't want to lose if we don't have to. So does that answer your question?
Close enough, I suppose. Okay, well that works.
It's dependent. It's dependent on the virus. We're trying to keep surge capacity, but we have to also find efficiencies and balance our budget too.
Of course, understood. Okay, my follow-up question is also for you, Dr. Etches. Just at some point during the meeting, you mentioned that we're not at a point where we have to lean on directives and mandates, but there could come a time again. I'm wondering if you have an idea of the threshold that might be required where you would recommend or implement a mandate of whatever kind, that, like the ones we've seen in the past.
Yeah, I think what we would need to be concerned about would be something where we don't see voluntary behavior change making enough of a difference in severe illness. outcomes. And that may be in a situation, say, with a new variant that's very severe, causing more severe illness, something very transmissible that is so prevalent that it's overwhelming how our society is functioning, not where we're at now, which is that people are able to get back to more of the things they need for their well-being, and our hospitals are able to keep functioning, and we're still, I'd like to see less severe illness, but we are able to treat people who need that treatment for COVID-19.
Thank you very much, Dr. Etches. Thank you, Ted. Next up, we have Joanne Lalchis at the Ottawa Citizen. Joanne, over to you. Okay, maybe
Sorry, Max.
There we go.
Hi, Max. Sorry, it's Nikki. Just because Joanne doesn't appear to be here, I just want to flag that there is a request to have a French response. So Vera, if you wouldn't mind responding the same request in French.
Ok, oui. La situation où c'est possible que je vais donner un ordre encore, ça va être une situation tellement différente qu'aujourd'hui, où peut-être il y a un nouveau variant qui cause les maladies sévères ou qui est tellement transmissible. Le système de la santé et les systèmes essentiels, les services essentiels sont trop affectés pour continuer avec les activités où ils sont essentiels pour notre société. Alors, c'est là, mais on a toujours une approche en santé publique de commencer avec les approches moins restrictives, de aider les gens d'être informés, de choisir les actions, les comportements qui donnent la protection. Et c'est la situation maintenant où on a la possibilité pour les gens de retourner aux des différentes activités importantes pour leur bien-être. Et c'est possible maintenant de gérer la situation dans les hôpitaux. Mais toujours, je voudrais voir qu'il y a attention au peuple immunodéprimé. Ça, c'est aussi important parce que ce n'est pas juste notre action qui touche nous, mais c'est possible aussi d'affecter les autres. Alors, le rôle de Santé publique Ottawa, c'est d'expliquer la situation, expliquer les messages clés, les comportements importants pour le niveau de COVID-19 dans la communauté à ce moment.
Merci beaucoup. Nous allons donc procéder en français avec Rosalie Sinclair à Radio-Canada. Rosalie, c'est à vous.
Oui, bonjour, Madame Etches. Il y a un convoi qui s'en vient en fin de semaine à Ottawa. La police a émis un communiqué pour parler des différentes règles, en fait, des mesures qui vont être mises en place là, pour pas qu'une manifestation comme celle qu'on a connue cet hiver arrive à nouveau. J'aimerais savoir un peu comment vous voyez la situation. Cet hiver, vous avez soulevé des problèmes là, justement de santé pour les résidents d'Ottawa. Donc, comment vous voyez l'arrivée d'un nouveau convoi? Est-ce que ça vous inquiète?
Oui, l'équipe de Santé publique Ottawa est vraiment activée pour travailler avec la ville et la police pour aider la population de gérer la situation, mais c'est clair, il y a la possibilité que c'est stressant après l'expérience avec les camions et les autres protestes. Alors, on a vraiment des messages déjà qu'on partage avec la communauté pour la promotion de leur bien-être et leur santé mentale, parce que c'est peut-être stressant encore. Alors, on va participer avec nos partenaires et continuer de communiquer les messages pour où les gens peuvent trouver soutien. Il y a toujours la ligne de crise, mais il y a d'autres soutiens aussi et notre équipe va partager cette information.
Est-ce que je pourrais vous entendre en anglais là-dessus, s'il vous plaît?
Yeah, so you were asking me about the situation the police are describing with motorcycles coming to the city in large number, and it definitely is a concern for Ottawa Public Health. We think this could be very stressful for residents of Ottawa, particularly reliving, remembering the occupation that's previously happened this year. And so Ottawa Public Health is already working with the police, who are the lead, and sharing information about how to help manage the situation, especially concerning our mental health, and that there are places to turn, the crisis line, distress center line, but other supports. So we'll be working with the city to get this information out.
Merci beaucoup. Puis, ma deuxième question, ce sera à propos de la situation de la COVID-19. Vous avez dit un peu plus tôt aujourd'hui qu'on voit une certaine stabilisation, que la situation se stabilise un peu au niveau des hospitalisations, mais aussi au niveau des employés qui sont retirés du milieu de travail pour la COVID-19. Est-ce que le pic de la 6e vague est passé à Ottawa?
C'est possible. On n'a pas toute l'information après la fin de semaine longue pour voir s'il y a un impact, une augmentation avec les nombres de contacts. Mais l'information que nous avons maintenant, c'est qu'il y a une tendance de diminution dans le eaux usées, le niveau de COVID après le 11 avril. C'est lentement qu'on voit la diminution, mais c'est là. Aussi, les autres mesures, on regarde, ça prend temps pour tourner aussi, parce que quand quelqu'un est hospitalisé, c'est un nombre de journées que les personnes sont là. Et quand quelqu'un a besoin de les soins intensifs aussi, ça peut durer plus de temps. Alors, j'imagine on n'a pas le pic de l'hospitalisation, mais j'espère que ça peut suivre.
Merci beaucoup.
Merci beaucoup. And yeah, thank you folks for being here today. That's all the time we have. And thank you for tuning in. I would say see you next time, but it's actually my last media availability for the time being. But thank you so much for being here. During the past 1 year or so that I've been with Ottawa Public Health, and it's been an honor to be by your side and help get this information across to residents. So your part is valuable, and I thank you for that. And thank you for being part of my professional journey.
Merci.
Thanks, Max.
Merci. Thank you.